So to jump right in, you hear Medicare Part A all the time. What does that actually mean? So what is covered by Medicare Part A? It's your inpatient hospitalization, home health care, hospice care, and skilled nursing care. And as you can see, those last three here on our presentation, they have the stars there, and that's because they must meet certain conditions in order to get those benefits. And so the next slide, I'll talk more about that. So if you only have Medicare Part A as your health insurance, these red numbers here are going to be your cost exposure. So this is what you would owe if you found yourself in the hospital and you only had Medicare Part A. So for your first 60 days, it's going to be a $1,600 deductible. Any of you that have even walked into the hospital or the ER, you know that that's pretty much going to be covered just by walking through the doors. So that's just your deductible there. And then if you're in the hospital for days 61 to 90, it's going to be a $400 a day as a daily copay. And then days 91 through 150 is $800 a day as a daily copay. So those numbers are pretty big. We're not trying to scare you or overwhelm you. We just want you to be aware of how Medicare Part A itself works and then what's going to be covered by that. So now if you need to go to a skilled nursing facility, so this is after you're released from the hospital, if you need more care, you're not able to just go home yet, and they sent you to a skilled nursing facility, your first 20 days will be covered by Medicare, and then days 21 through 100 is going to be a $200 a day daily copay. So most people, they pay $0 a month for their Part A premium, and by most people I mean if you have been living in the United States and working and paying taxes for 10 years, or you have a spouse who has, then you'll owe $0 a month as your premium for Part A. All right, Medicare and skilled nursing claims. How do you know your skilled nursing claim will be covered by Medicare? Well, first of all, Medicare is only going to pay for that if it was preceded by a minimum of a 3-day inpatient hospital stay. So that means you have to be admitted as an inpatient into the hospital for a minimum of 3 days. You also need to go into the skilled nursing facility within 30 days of leaving the hospital, and it has to be for the same condition that you were in the hospital for. Medicare doesn't cover custodial care, so that's if you need help cooking food, getting dressed, that type of thing. They're only going to cover if you need actual medical care by a nurse. And it doesn't cover any costs for assisted living or nursing home care. So we have a fellow agent that likes to share the story, and we think it's a really good illustration of how this works. And she was out on a walk, she fell and broke both of her wrists, so she was in the hospital. She was in there for about 3 days, I think it was, maybe a little bit over, but at least it was 3 days. And they got her all fixed up, all better, but she had 2 broken wrists, so she couldn't just go home. So they sent her to a skilled nursing facility, and Medicare denied paying that claim because they said that she didn't need medical care. She only needed help with those activities of daily living, getting dressed, showering, preparing food, that type of thing. So they actually denied that claim. And I don't tell you that story, to create anxiety or anything like that. I just want you to be aware of how it works so that you can kind of know how to protect yourself and how to work with the Medicare system.
Because there are plans that will cover that if Medicare doesn't cover it, just short-term care plans, things like that. And so there's insurance for everything, and that's our job, is to help you understand what's out there, how things work, and make sure that everything's covered. So that is Part A and skilled nursing care, and continue on to the next video if you want to learn about Part B.